Jai Hind everybody. In continuation with the implant short preclinical videos of Perio Subharti, we had given two preclinical videos earlier. The first preclinical video was on the various types of implant kits and we had explained nicely about the physiodispenser apparatus. In our second preclinical implant video, we had shown the demonstration of implant placement in an artificial mandible. Based on the comments and the requests on these two videos, lot of you had requested about a video on the simple surgical armamentarium, the basic surgical armamentarium which is required during an implant surgery. So today's video would be on this basic implant surgical armamentarium which is required in addition to the implant kit. As an implantologist, I always emphasize that the definition of implantology is it is prosthetic driven surgical treatment modality. What does that mean? That unless and until our basic dental surgical skills of IRS are not strong enough, we can never be a good implantologist. So, in order to enhance your IRS skills, you need a good surgical armamentarium first. Okay? So, the surgical armamentarium can broadly be divided into four basic categories: the diagnostic instruments, incision and reflection instruments, debridement instruments, and the suturing instruments. So, I'll just be covering about one or two important instruments under each of these four categories first. Firstly, the diagnostic instruments. In the diagnostic instruments, a very important instrument other than the mouth mirror and the tissue forceps is the UNC15 probe. So, the University of North Carolina probe is a very important instrument for assessing the initial depth of the osteotomy that we have prepared with our Lanstel. If we were to try to use a depth gauge, which is available in the implant kit, that depth gauge is actually too broad to be inserted initially. So this is a beautiful instrument, UNC15. It has black bands at 5, 10 and 15 millimeter. So straight away we get to know the depth of the osteotomy that we have prepared. After this, we come to the incision and the reflection instruments. So always and always, we use a number 3 BP handle. It can be either flat or round cross section. Number 3 BP handle basically fits surgical blades number 11, 12 and 15. Number 4 on the other hand would fit the prosthetic blades of 20 to 24. In surgery, we have to use number 3 BP handle. After that, we always advocate the use of two periosteal elevators, a thin, sharp periosteal elevator for reflection and a thick periosteal elevator later on for retraction. This has to be of a very good standard company and this has to be sharp so that the flap reflection becomes easy. After this, we move on to the third category of instruments, and these instruments are debridement instruments. In this, we have two instruments, one for delayed implant cases and one for immediate implant cases. So, for delayed implant cases, we have University of Columbia 4R4L curate. So, this curate basically is a very good universal curate which can be used for debridement of minor granulation tags which might be present after flap reflection. On the other hand, suppose we are trying to place an implant in a tooth which has a huge periapical radiolucency and we have to excavate that periapical radiolucency. That is where a Lucas bone scoop, this is a Lucas bone scoop which is a surgical curate. This curate is very useful. So these are the two curettage instruments that you require in implantology. And finally, in the basic category, we have our suturing instruments. We have a Goldman Fox scissor and we have a tungsten carbide coated needle holder. So what is the meaning of Goldman Fox scissor? That basically means that one side the needle is, the beak is serrated, the other side the beak is sharp. So the advantage of this scissor is that once flap reflection has been done, not just for suture cutting, whichever granulation tissue is there on the inside of the flap, that can be used for cutting with this Goldman Fox scissor. The advantage of the serrations would be that basically the granulation tissue won't be slipping away. And the needle holder, what we use is the tungsten carbide coated needle holder. So the advantage of using a tungsten carbide needle holder is It doesn't get blunt even after repeated cycles of sterilization that easily, and the grip on the thread is excellent. So this was the four category of instruments. Other than this category, we require some basic instruments also surgical. Those would be our cartridge syringe. This is the cartridge syringe that we use in our implant cases. And for wider flaps, we use a mini sorter retractor when more multiple implants have to be placed. Other than that, always and always we have to use luxators. A basic luxator is always required in all cases of immediate implantation so that atraumatic extraction of the tooth can be done. The last two instruments are, one instrument is basically bone caliper. So bone caliper is an excellent instrument, not just after reflection to know the buccolingual width of the bone so as to select the correct implant size, especially with regard to multiple implant placements. The 1, 2, 3, 4 rule that we say, it is quite useful for measuring the distances at which the osteotomy is supposed to be done. This was covered in our earlier video also, the 1, 2, 3, 4 rule of implantology, a very useful and very essential instruments, especially with regard to multiple placement of implants. And the last category of instruments basically are the bone grafting instruments. So we have a bone graft carrier syringe by which, after mixing the particulate bone graft with basically saline or blood, we can mix it and then we can lift it and carry it in the defect. Once we have carried it in the defect, for condensation, we can use a bone graft condenser. This condenser on one side has a bone graft carrier spoon also. But the issue is, in this, if I were to carry the bone graft like this, I'll require another instrument actually for condensing or putting the bone graft in the defect as such. Hence, we can use a bone graft carrier syringe for carrying the bone graft and then a bone graft condenser for condensing the bone graft. Hmm? So this was about the basic instruments, surgical instruments which are required in implantology. So this was basically a short preclinical demonstration of the basic surgical armamentarium which is required in each and every implant case. One of the things which I would like to point out is that this basic surgical armamentarium is many a times lacking in majority of our implant cases. We hope this demonstration would be useful to you. Any doubts you have, please do ask in the comment section. Our next short clinical video would be on the preclinical demonstration of various types of particulate bone grafts. That is, we'll be comparing allograft with xenograft and alloplast with regard to the mechanical handling properties of these particulate bone grafts. So till then, have a nice day. Jai Hind.